Hello, it's Dr. Steve Nichols. I'm an ophthalmologist with the Tasmanian Eye Clinics, and this video I'm talking to you about the treatment of dry eyes. Now, by the time patients have come to me, they've usually tried half a dozen different bottles of dry eye drops, and some patients may be using them every 10 minutes, and almost certainly that patient is starting to get allergy or toxicity to their dry eye drops, particularly because there's a common preservative called benzalkonium chloride, and that acts like a detergent in the eye. So one of the things that we often do early is change a patient to a drop without any preservative, and they usually come in little single-use ampules. And because there are no preservatives, that toxicity can soon settle down. We sometimes also have to use creams, and they're used at night time, particularly if there's a night waking problem. Unfortunately, sometimes even the frequent use of drops is just not enough. More can be done, however, and one of the things that we do is insert punctum plugs, because about 80% of our tears are drained by our tear ducts, which runs down to the back of the nose. And if we put a little plug in there, it holds back your own tears. And this is very effective. And you'll neither feel the plug in there or see that they're in there. And these plugs will hopefully last a long time and reduce the need for drops. This is a punctum plug applicator. It looks a pretty mean device, doesn't it? But you don't have to worry. You have anaesthetic drops in your eyes, and the action piece is right at the end. There's a tiny little silicone plug there that's inserted into your tear duct. And as has been said, you'll neither see this or feel it. It just acts to stop the tears draining down your tear duct. It only takes a few minutes to put in. Many patients with dry eye disease also have problems with their eyelids. This may be from blepharitis, and that's when you get a lot of crusting and sleep on the eyelids, or meibomianitis. Crusting can be dealt with by mechanical cleaning, and there are preparations available at the chemist to help bathe off the crusts. If you've got meibomian gland disease, heat is particularly effective for that, and also massage of the lids, and omega-3 fatty acids, as found in fish oils, have also been found to be beneficial. We also need to pay attention to a patient's general health. Sometimes it may mean modification of medications or cutting down the use of antihistamines, which also cause dry eyes. Other common medications that affect the tear secretion are the tricyclic antidepressants and beta blockers that are taken for hypertension. There are some more recent treatments for dry eye, including a drop called cyclosporin, which is an anti-immune drug put in tear drop form, which is quite safe because there's very little systemic absorption. Unfortunately, the meibomian glands are not easy to treat, and despite frequent attention and omega-3 oils, the meibomian glands still cause a problem. Various other treatments have been explored, and we have looked into these. Laser treatment is a recent therapy that has been used, but another therapy is called Maskin probing, and this involves little punctures in the meibomian glands, and this appears to give the best results from the data that we have surveyed and also our own clinical experience. So call the clinic if you wish to find out more about this, as we have some material available for you. Thank you.